Okay, welcome back dear friends. I am Dr. Klim Raza. Today in this video lecture we are going to discuss about these major muscles of the mastication. These are very important muscles. We have discussed in another video lecture muscles of the mastication, especially the tongue muscles, also intrinsic and extrinsic. But today we are going to focus on these muscles, and first we are going to discuss here is the temporalis. So this is your temporalis muscle. Temporalis. It originates from temporalis fossa and it's inserting on carotid process of the mandible. So its origin temporal fossa and it insert on carotid process of mandible. So action is important, and remember all mastication muscles are basically innervated by mandibular nerve, which is a third branch of trigeminal motor nerve passing through foramen ovale. Yes. Okay, so action of this muscle is elevation of mandible plus retraction. Retraction means pulling back. Elevation and retraction. Elevation and retraction. Elevates and retracts the mandible. And then second muscle here you can see this is your masseter muscle. Superficial, and we have got deep also, masseter muscle. So it's originating from this zygomatic arch and then inserting here on the ramus of the mandible, but inserting on the lateral surface of ramus of mandible. So this masseter muscle is originating from zygomatic arch. This is zygomatic bone, and the function of this masseter muscle is elevation and protraction. Elevates and protracts. Elevation and protraction of the mandible. Okay, then next we have got medial and lateral pterygoid. Medial and lateral pterygoid. So this is your medial pterygoid. Two heads also, medial pterygoids. So medial pterygoid, this muscle originate. What is the origin? Origin is maxilla bone, but tuberosity of maxilla, and its insertion at the 2 points. One is the medial surface of ramus of mandible, and second is also the angle of mandible. So its insertion is important. So what is the action of this medial pterygoid? So remember, M for medial, M for maxilla, and M for medial surface of the ramus. So in this way you will not forget its origin insertion. So medial pterygoids originating from maxilla, tuberosity of maxilla, M, and then inserting on medial surface of the ramus of the mandible. Action, elevates and also protraction. Elevation and protraction. Elevation and protraction of mandible. So it's mean that temporalis is the only muscle which retracts the mandible. Masseter and medial pterygoid, both these protracts the mandible. So remember please. Okay, and then this fourth one, then last one here we have got the lateral pterygoids. Here you can see two heads of the lateral pterygoid, and this is frequently asked muscle and question in your exam. The lateral pterygoid originating from this infratemporal fossa and at the greater wing of sphenoid, and inserting at this temporomandibular joint. temporomandibular joint. Action, this is a unique muscle. Why? This lateral pterygoid muscle help in depression of the mandible, opening of the mouth. So opening of mouth, opening of mouth or depression of mandible, this is basically action of lateral pterygoid. So I hope you understood the origin, insertion and the action of these muscles. Thank you for your concentration.